Happy New Year, everyone. My name is Laura Kelley. I am chair of the Miami-Dade Democratic Party. But today we're not going to be talking about politics or a political issue. This is a nonpartisan issue. We're talking about public health. And I am so grateful to have our guest on today, Dr. Gordon Dickinson, who is Professor Emeritus at the University of Miami School of Medicine. Thank you so much, Dr. Dickinson, for being here with us today.
Thank you for letting me come and express some of my views. Important issues today, and which unfortunately, not a political issue, but it's been sort of politicized, and it shouldn't need to be. And so just to let people know who I am, I'm obviously a little bit older. I came into my niche in medicine in the 1970s when there was a plethora of new antibiotics for you could treat just about any bacterial infections. And if you had resistance problems, next year there would be a new antibiotic. So it was a happy place. You could cure and treat people. And so that's what got me into this field of infectious diseases. And then not many years after I joined, the HIV virus emerged and then sort of changed my career. But that's what I've done a lot of throughout my career. And but late in my career, a pediatric infectious disease friend from Buenos Aires, Argentina, is sort of an entrepreneur and was developing an NGO here in South Florida to address adult immunizations, because in those days, all the children were vaccinated by mandate to get into school. And we adults tended not to get vaccinated, not because we were against it, but just because we didn't like needles, we were too busy. Lots of excuses.
Guilty.
And so, and in particular in those days, the Hispanic Americans as a group lagged the general population as adults getting vaccinated. In reality, they don't lag that much, and the whole adult population tended not to get the protection that they might.
And may I ask, Dr. Dickinson, why is it so important for adults and not just children to be vaccinated? For example, we mentioned the Tdap vaccine when we were talking off camera earlier, but to get your booster shots and continue to take vaccines as you age.
Well, for most adults in the pre-60, pre-65 era, it's only a rare and vaccine-preventable disease that hits them and causes disaster. But there are practical effects. I mean, people tend to play down influenza. And part of that is because anytime you get a common viral infection, adenovirus, rhinovirus, and people call it a flu,
right,
whether it is or not. And those tend to be mild. The real influenza can be, I mean, you may not die from it, but you almost wish you were dead while you have it, because very high fever, feeling miserable and unable to function for a week, and so, okay, well, that's not so bad. Well, it depends on what you're doing. Right. I mean, if you're a star on a professional sports organization, and a big game comes up and you get hit by flu, you're out. There are costs and there are problems. And then for the older population, there's a growing potential for severe reactions, and including lethal outcomes from other diseases, influenza, COVID, respiratory syncytial virus, and a host of other
Yeah, absolutely. I actually always say this to my colleagues and friends and my family, like, please get your flu vaccine, because what you thought was the flu in the past is sometimes just a cold, and flu knocks you out. Like you said, doctor, for a week, it's miserable. I think I've only had the flu once in the last 10 years, and it just happened to be the 1 year that I didn't get the flu vaccine. And I was like, never again, because it really, like you said, we tend to say the word flu rather than cold, because, I think we're kind of babies. I know I'm a baby when it comes to getting sick, but the flu really knocks you out. But there's another piece to this, isn't there, about herd immunity? And I wonder if you could explain what herd immunity is and why it's important for all of us to take public health as, personal responsibility, but also personal responsibility to others that we have.
Yeah. Well, as I mentioned earlier, the politicization of the vaccines is really been disheartening for me. On the other hand, we are political creatures. We're social creatures, that's who we are. So that's understandable. But the things there's some things that people may not appreciate. And one is that vaccines are brought about after probably millions of hours of research from people working in laboratory, working with animals, working with molecular biology, epidemiologists, and then doing clinical trials. I mean, you have no idea about the foundation of work that goes into coming up with a vaccine. And so in this country, we've been fortunate. We really have had a very good system. And back in the, listen, I could ramble on. You're going to have to chop me in. But back in the 60s, the Centers for Disease Control established an ad hoc committee in which they brought in lab folks. They brought in epidemiologists, they brought in infectious disease people, they brought in pediatricians, they brought in public health people with the charge of reviewing all new vaccines that are been brought to market. Incidentally, to clarify, a vaccine is developed and they must show efficacy and safety, and that is presented to the FDA. The FDA has the say of whether a vaccine can be administered in this country. The CDC's committee is the group that says who should get it or how it should be used, because that's the expertise that they bring together. And so this committee, 3 times a year, would meet. They would look at any new vaccines, and subgroups of the committee were assigned to review the existing vaccines and make changes, in which they do from time to time. Things get updated.
Yeah, and research. There's new research. Yeah, there's new research that comes out.
Findings come out. A good example is the yellow fever vaccine, which most of us don't encounter unless we're travelers and going to areas where yellow fever exists. And that it once was said you needed to get that every 10 years. And actually, accumulated data show, 1 time is good.
Excellent.
That's all you need. So we've had this system that is really good. Is it perfect? No. And they've made mistakes and they've corrected and gone on. But it is as good as you can get in coming up with a foundation for policy in using vaccines.
One of the things that concerns me just generally as a person, as a human being, is the fact that on one hand, information is so easily to obtain, right? So we have the internet, people can look up a lot of information. That's a good thing. But at the same time, if we don't have people who are perhaps have the scientific literacy or education or critical thinking skills in order to evaluate that information, they feel that they are experts on what they're reading or they're seeing rather than having confidence in the expertise of medical and scientific professionals. And I think this like death of expertise is a real problem because, again, information is at our fingertips. But I'm an immigration attorney. I know that I cannot evaluate scientific data. I can't evaluate efficacy or safety of a vaccine schedule on my own. I rely on experts, and I have to trust experts. And I do trust experts because I've seen, we can look at history. That's one thing that we can have a little bit of expertise in, is looking at and seeing how the creation of vaccines has stopped vaccine preventable deaths. So we could go back to the polio vaccine, the smallpox vaccine, and more recently, the HPV vaccine, which has the ability to prevent deadly cancers. It was cervical cancer in women and other cancers in men. And when that vaccine, for example, first came out, it was only approved for women up to age 26. I got it at 25 and a half years old, and I was happy to have it. My daughter now has it at 11, but now it's open to men. Like you said, they changed the schedule because they look at more information. They say, oh, wait, what's the best way to protect everybody?
The women researchers were a little upset that the guys weren't.
As I said, why aren't 11-year-old boys also getting the vaccine at the same time? And again, it's new research, new understanding. We just changed the schedules. Now it's approved, I believe, up to age 45. It's the vaccine covers more strains of the HPV virus, which causes cervical cancer, penile cancer, throat cancer, a number of other cancers. And again, it's I think a revolution in terms of public health. But we also have people like Joe Rogan, who's very popular. I don't know if you heard this recently. He said about the measles. Oh, well, when I was a kid, everybody had measles as a kid. No, we did not. No, we did not. We did not have measles as children. We had chicken pox. Again, that's kind of like the flu cold dynamic that you were talking about earlier. Measles, I had a friend actually from the United Kingdom who had measles as a child and lost hearing in one ear because it is such it's a devastating illness and a deadly illness, correct?
The problem with measles is it's so contagious that you can get many cases. And yes, the risk for an individual is relatively low, but it ain't zero. And when you have many folks getting in measles, that's when you run into problems. And, just aside, the figures for influenza in children have given me a pause to think about a little bit. There's usually around 150 to 200 cases of children that die of influenza each year. So come on, we're a country of 335 million and only 200 children die. I mean, that's nothing. It's probably a way under a fraction of a percent. Unless you're the child or you're the parents of that child. And that is devastating. I think one of the hardest things in life in terms of tragedies is to lose a child, whether certainly as an infant, as a young child, it's just life-changing and devastating for many people. So but you brought up there's an issue of vaccines and how we use them, and the element of recommendation that goes into the use. Now, the HPV vaccine, why is that recommended at age 11 for boys and girls? Well, because that is before most are sexually active and you produce immunity. And Why did they say 26? Well, because
I can explain.
because the vaccines are not free. I mean, they are a resource. They take some resources from the overall health budget. And so most people have already acquired HPV by the time they reach 26. Do all? No, of course not. There are people that are older. And you mentioned, and yes, they say, well, it's a mutual I'm blocking the term of shared decision-making is the term. Well, listen, that's sort of bogus. It's shared decision-making from the moment the doctor and the patient is together.
Right.
Because the patient is the patient. We're talking about the patient, not the doctor. So the patient has to agree. But any of that aside, but they said at 45, but I can see meeting someone who, for whatever reason, has been a late bloomer, and in their 40s, they decide that they're going to become sexually active and do so. I would give them the vaccine. It depends. And the public health would not, because they don't recommend it because it's not apt to produce protection for someone. There's no one that needs the protection.
I think to kind of translate this to lay terms, if you'd permit me, Doctor, is that, they have limited resources. If you have limited resources, we need to do the most good for the most amount of people. And then also, again, this has a cost. Also, insurance companies, don't basically you can get any vaccine you want if you're willing to pay out of pocket. The question is whether insurance or, will pay for it. There's these restrictions on the recommendations and how we use them. So that would, like you said, so HPV, human papillomavirus, is, like I mentioned previously, the virus that causes cervical cancer, just to give one example. It is a sexually transmitted disease. But at the same time, the vast majority of people will become sexually active at some point in their lives. And if we can prevent cervical cancer, penile cancer, throat cancer, and we've seen some people die of, very famous people die of vaccine preventable diseases, her famous actress that is escaping my mind at the moment, who died of this vaccine preventable disease I want to say maybe 5 or 6 years ago. But nevertheless, I understand that with parents, and I'm a mother of a daughter who's 12. They probably don't want to envision their children becoming sexually active in the future. I think some people could bristle at why 11, but I think you mentioned very clearly is we want to get this protection early, well before anything could happen. Yep. I would say either on purpose or outside of that child's consent as well. And I think that's a thing that we also have to think about, that there are things that may happen to our children that we want them to be protected from, that we can't necessarily prevent because there are bad actors in this world. Yeah. And for me, it was an easy decision to get my child vaccinated at 11, to start the course, because I believe it's 3 shots or 3 vaccines before you're fully protected. At the same time, my understanding is the vaccines change over time. So there's different strains. You might get one strain, but you maybe at 26, you've got 1 strain or 2 strains that you have been exposed to. And most people have no symptoms, and it's not going to cause them any problems. Their body sheds the virus easily and without any complications. But maybe, I know that Gardasil itself has become a better vaccine over time, and now it covers more strains. And so there's that balance that has to be made, is like whether based on age and experience, whether, it makes sense to get this vaccine later in life or earlier in life. And those are like you said, that's a shared decision making. That's a conversation with a physician, and not relying on people like perhaps Joe Rogan to help you make that decision, or Laura Kelley, by the way. I'm not an expert. And we all have to make our own decisions, but I think we have to think about it in terms of a larger interplay of not only how I would say the medical community or scientific community thinks about it, but also for us, what is going to be the most good for the most people? What's going to be the most good for myself as a human, for my daughter as a child, and then also the community writ large. You mentioned the influenza vaccine. I agree. I mean, we might say 200 deaths is a small number, but it's devastating for the people who experience that.
And it could have been prevented.
Right.
It's needless. And the vaccine does not cause significant threat to your health in any way, other than a sore shoulder.
Similarly, the seniors, senior citizens have a much higher death rate with influenza. And it's, for me, that's devastating to lose a family member from a preventable illness. That's truly devastating. And I think, when we think about the term pro-life, it's really valuing human life. To me, that's what vaccines are about, is valuing human life and preventing diseases so that we can all prosper and be healthy and be, productive. I mean, you mentioned earlier about the CDC and recommendations and how vaccines are approved through the FDA. I think that when the COVID vaccine was introduced to the market, a lot of people were skeptical of this vaccine because it seemed to be so quickly brought to market. But correct me if I'm wrong, doctor, and I'd like for you to explain this. This type of vaccine actually had been worked on. There's like you said, I'm going to use your word, plethora of research that went into that vaccine's development even before that disease was discovered. Is that not correct?
Yeah. Vaccines have evolved from actually inducing an infection with a similar infection. That was the Jenner's discovery with the milkmaids in England, which was a career at that time. And the dairy farms used young women to milk the cows. And they did not get smallpox, but they did get cowpox, which was a pox infection of cows that did not cause serious illness for the young ladies. So they got it and they were protected. And Jenner and several others put that idea together and started this vaccine. And then, so they've been involved, and for many years, it basically was grinding up the bug and then injecting it when it was killed, or to try to produce a weakened version and give you the infection. And it's a very long, interesting, and for historians, a delightful story to unravel over the years. I mean, the first vaccine after Jenner's work with Vaccinia was Pasteur, and he developed a vaccine against rabies. And rabies is a horrible disease because you develop these symptoms and you're going to die from it. It's almost 100% lethal.
You gave me chills, doctor, I have to say, because rabies is actually, I have an irrational fear of rabies because it's so deadly. I think there's only been 1 or 2 people with a confirmed case of rabies that have ever survived.
They did not survive without severe impairment.
And a protracted,
Anyway, Pasteur went to work on it. At the time he went to work on it, they didn't know what caused it. They had no idea of how it happened, but there were a lot of dogs in France with rabies. It was a big problem. And so there were a few cases, and very scary. And by today's standard, his work is just scary, because what he did was he worked with dogs. And the problem with dogs is they bite. And so there were a couple of people working in rabies research, that died bitten by rabid dogs. So they figured out that they could inject it in rabbits, and rabbits were easier to work with, docile. And then he'd pull out the nervous system and dry it out and concocted an emulsion from this dried out nervous tissue from rabbits that had been given rabies, and then started injecting that. And his first vaccine was actually injecting live rabies into the person. Now, the first one, it was a whole series of vaccines, and the first one was totally dead. The next one was just about all dead. And then finally, you were getting injections with live rabies. And today, there's no way in hell that would have ever been approved for development or use. But the thing about a word about the COVID vaccine and development. Number one, we're trying to say this is not a political issue, but I think Trump deserves a lot of credit for this warp speed development. It's a Trumpian kind of move to put a lot of money and effort into something, and whether he really gets credit for it, I would give him credit for it, but it worked. And the two vaccines that came out ahead were a whole new development. I mean, they now, with a vaccine, with an infectious microbe, if you will, that can cause a disease, we know which parts are vital to causing the infection or maybe causing the disease. And so by identifying those parts, the Chinese very quickly had the whole sequence of the SARS-CoV-2, which was the virus, laid out. They knew which were the critical parts very soon. And the new technology, which is revolutionary, and by the way, before we get off, there's another revolutionary thing I don't want to forget to mention. But they used these particles that were the real infectious weapon of the virus, and they were able to inject that in messenger RNA into my shoulder, and what my shoulder muscles did and other parts throughout my body would produce this part of the virus that wouldn't cause me disease, but really elicited a strong immune response. And that's how the protection was. And the nice thing about that platform is it's very easy in the laboratory, in the factory, to adjust that to new viruses, new strains, and the technology is wonderful. Are there some things to be watchful for? Yes, there are. People are talking about the myocarditis, the heart problems, and there's something about the COVID virus that, yes, causes severe myocarditis and long COVID, which we're learning about. And the vaccine may produce a little bit of that. So there are people concerned about that. But that virus became available under emergency use because the FDA said, we don't know enough about the safety and efficacy. It looks really good. And so it was induced, and now it's no longer under that. It's been shown. It really works.
I mean, I could tell you that my sister is a physician. Her husband is a cardiologist. They were both working in hospitals while the COVID pandemic was emerging. And my sister was actually pregnant at the time, and she got the vaccine. And so did her husband, of course, to protect themselves so that they could continue to work for patients who were sick with COVID and not disrupt, the ability to, cure people, help people. And I thought that was incredibly just amazing that they were able to do that. And again, I think there's this risk reward thing that every human has to, or every person has to think about, which is what is the risk of harm from taking a vaccine? You mentioned there are side effects to every medical intervention. Every time there's a possibility of side effects.
Yes.
But for vaccines, it's very low, and we have to think about it relative to the risk if you get the illness, right? So getting COVID, which could produce, right, for some people it's very mild, but if you get long COVID, it could be debilitating.
Life-changing illness.
And we know that about 4 million people in the United States alone died from COVID. We also know measles, something that, may be mild for some people, can cause death and impairment lifelong. Same thing when we're talking about HPV, cancer, deadly cancer. Really devastatingly deadly cancer. We have influenza, which could take you out for a week, which will not let you to work. Could kill you.
Could kill you. Yeah.
Exactly. And there's other. There's a lot of vaccines out there, but even something like shingles, which is something that typically older people get. It's devastatingly painful. That if you can prevent that, why not prevent that? Because if you get shingles, it is awful.
I learned a number of years ago. Here, I'm an infectious disease doctor, and I was wondering who was giving lectures about shingles and who was the expert. And it was the head of the pain clinic, because of people could get shingles and then they get a post-herpetic pain syndrome that lasts for months, years, and is just devastating.
Yeah.
I would like to just mention a couple of things. One is that if farmers stop farming, I'm going to starve. If truckers stop trucking, I'm going to starve. If trains stop running, I'm going to starve. We are so interdependent. We are social creatures. That this pen lying in front of you, you didn't make that. Somebody put a lot of effort and put a lot of expertise into making that. These microphones, the electronics that allow us to do what we're doing. So we're all in this together, and that includes people in my niche, which is in infectious diseases and preventing diseases. So it's, yes, your question of trust. Well, we have to have some trust with one another. And how do you do that? I think you look at the evidence, you keep an open mind, and you check your news reports. You don't go with one source. And, we do the best we can.
And make sure they're credible sources, right? We know we have to be able to evaluate the credibility of sources. And I think, again, recognizing that your family physician, right? Your family physician is somebody who has treated you, who cares for you, who has taken an oath, the Hippocratic oath and is so involved in making sure that their patients are healthy and happy. That to me is the best trust. Now, no physician is perfect, just like no human is perfect. We make mistakes, all of us. But we have to have trust in the process and in our, if not scientific researchers or the medical community writ large, but certainly the physicians who treat us day in and day out.
Yep.
And so I want to say thank you for your service, Dr. Dickinson. And
my pleasure.
Thank you so much for being here. This is a fascinating conversation. I could continue forever.
Okay.
But we're out of time now.
Okay.
But thank you so much for being here.
My pleasure. Thank you for having me.
I appreciate it.